Hi doctors, how are you? Hope you all doing good. As I said in last video, today I'm gonna discuss about Dadru Kuṣṭha of Kapha-Pitta dominant. Yeah, Dadru Kuṣṭha is already a Kapha-Pitta dominant, but still in clinical practice we get three variants of Dadru Kuṣṭha, that is Kapha-Pitta, Vata-Pitta and Vata-Kapha. So I will discuss today about Dadru Kuṣṭha of Vata-Pitta dominant. Okay, and it is we get this kind of condition in acute, or we can say in subacute conditions. Okay, not in so chronic. In chronic we will go with Vata-Kapha dominant only. In acute condition we will go with Dadru of Kapha-Pitta variant. Okay, before going to Dadru Kuṣṭha clinically, I will explain some of the shlokas of Dadru Kuṣṭha given by different acharyas: Charaka, Sushruta, Vagbhata, Madhava, Dhāna and Bhava-prakasha. In few seconds I will go with all the shlokas. Kindly listen the shlokas. As per Charaka, kandu rakta kapittascha Dadru mandala samshrita utsanna tamravarnam cha pidakabhischa bhushita. Sushruta, Dadru mandare kanduryuktam tamravarnika utsanna pidika yukta Kapha-Pitta samudbhava. Vagbhata, kandu mandala yuktascha pidaka yuta samyuta utsanna dadru rakascha Kapha-Pitta prayojanam. Madhava nitana, kanduryukta samutsannam mandalam pidakam yutam Kapha-Pitta prakopena dadrurnama prajayate. Bhava-prakasha, dadrustu kanduryukta syat mandalotsanna samshrita pidakabhischa samyuktam Kapha-Pitta prakopajam. See, by listening all this shloka, you will get 5 Lakṣanas according to everyone. That is kandu, pidaka, rāga, that is tamravarna, and utsanna and mandala. Okay, 5 Lakṣanas. That is, kandu is itching, tamravarna or rāga, it is coppery red or red in color, mandala, it is circular, utsanna, raised margins will be there, and pidaka, that is pustules. See, before going to further, it is not compulsory, it is not mandatory that every Lakṣanas written in the shloka should present in the complaints of the patient. Okay, some patient will have only 3 Lakṣanas, some are 4, 5, and it may be 6 also. It is not compulsory that yes, each and every Lakṣana should be present in the patient, then only we can diagnose it as a Dadru Kuṣṭha. No. See, because in dark patient, when he comes to you, you cannot distinguish any kind of rāga. Tamravarna you cannot distinguish because skin color is dark, he will be in dark color. So how can you distinguish rāga or red color in the patient? No. Then can you do that? No. Rāga illa, avನ skin lesions red color illappa ಅಂತ ಹೇಳಿ ಇದು ದದ್ರು ಅಲ್ಲ ಅಂತ ಡಿಸೈಡ್ ಮಾಡೋಕ್ಕಾಗತ್ತಾ? No, it is Dadru. Okay, it is Dadru compulsory. So listening to all these 5 shlokas of different acharyas, main Lakṣanas are kandu, rāga, that is tamravarna, mandala, utsanna and pidaka. Pidaka may be pustules or papules, different. Okay, next coming to its nidhana. I am not going to tell deeply as per the samhitas, that is vidahi annapanani. I am not going to explain that. I will tell in clinical way. Patient will come you, most of the patients will be obese, diabetes patient or immunocompromised patients, or their diet or their food pattern will be very worst. Daily they will eat non-veg, curd, daily junk foods. Okay, hygiene is very improper. They will take bath 2 to 3 days, 2 or 3 days they will take bath. So hygiene is the main. Hygiene and immunocompromised, obese patient, diabetes. Okay, these are the main Lakṣanas, main nidhanas of the patient who comes with the tinea or Dadru patients. So next I will directly jump into the treatment aspect. Okay, treatment before going to treatment I will tell, don't follow exactly this treatment only. It is I am giving each and every treatment only in classical medicines, not patent medicines. Okay, I am just explaining about classical medicines. See, classical medicine, usually every doctor who practice Ayurveda and who practice classical medicines, every doctor will write first medicine is for Dadru, especially with the Kapha-Pitta dominant, is Patola Katarunyadi Kashaya. Okay, just one small shloka. Kuṣṭeshu Kapha-Pitteshu Visheshat Parikirtitaha Patola Katarohinyat Kashaya Prashasati. See, first only he mentioned Kuṣṭeshu Kapha-Pitteshu. It means the disease of skin which is dominant of Kapha-Pitta, you can blindly write Patola Katuranyadi Kashaya. Okay, you can write Patola Katuranyadi Kashaya. Okay, I will explain further. And next treatment, next Kashaya which commonly used is Aragvadadi Kashaya. One shloka further. Aragvadadikam Kashayam Kuṣṭagnam Kapha-Pittanut Rechakam Krumimehagno dāha kandu prashanikrit. See, in the shloka only you will understand what are the indications of Kuṣṭagna Kapha-Pitta. Okay, Rechakam Krumimehagno. See, we know Dadru is Dadru. In Dadru, Krumi is also involved. So, Aragvadadi Kashaya we can blindly write. So, where we can give Patola Katuranyadi Kashaya and where can we give Aragvadadi Kashaya? See, if a patient come with you towards you and he will complain of some gastrointestinal problem also. Okay. He will say, no, my motions are not clear. If I eat something, my abdomen will get distended. Okay. This kind of patients you can write Patola Katuranyadi Kashaya. And for who needs some internal shodhana. Okay. Internal shodhana. You cannot do classical virechana for the patient because of his time or different physiology. Patient is not feasible for the classical virechana, but you need some 1 or 2, daily 1 or maximum 3 boards of loose stools. So you can go with Patola Katuranyadi Kashaya. Okay, it will decrease the symptoms. And for Aragvadadi Kashaya, patient will come and tell you exactly, sir, doctor, my itching worsens at night time. Okay, Kafakala. Night time, my itching was at night time. Morning will be also, there will be itching, but at night I can't sleep. It disturb my sleeps. And that condition you can go with Aragvadadi Kashaya. Okay, you can use Aragvadadi Kashaya and it will decrease their burning sensation also. And after scratching, continuous scratching, due to continuous scratching, the pustules which are there in the lesions, they will burst and there will be mild bleeding or small pus, there will be discharge pus. On that condition, you can go with Aragvadadi Kashaya, and mainly for obese patients. See, obese patient, it is a Kapha Vyadi. Kapha, Meha, Kapha. So, Aragvadadi Kashaya will decrease the Meha also. Obesity also it is helpful. So, you can go with Aragvadadi Kashaya for obese patient. Okay, you can, and excessive itching at the night time, you can go with that. Next will come to Rasoshadi, that is Gandhaka Rasayana. Gandhakam Sarva Kuṣṭagno Rasayanam Visheshtaha. He had said Gandhaka Rasayana you can give in any skin condition. Sarva Kuṣṭam Rasayana, it is a Rasayana for Sarva Kuṣṭha, all type of Kuṣṭha. Maha Kuṣṭha or Kṣudra Kuṣṭha, you can blend the light for every Kuṣṭha, but you should not write by telling. Then Aragyavardhini Vati. Aragyavardhini Vati Yakrit Pliha Doshagni Kuṣṭha Meha Hara. Okay, Aragyavardhini Vati, it is actually Tridoshagna. Okay, it balances Vata, Pitta, Kapha. But maximum we use Aragyavardhini Vati in Vata, Kapha, Kuṣṭha. Okay, and Pitta involvement when it should be in Samavastha, Sama Pitta Lakṣaṇa, not in the case of Nirama Pitta. You should give in the Sama Pitta Lakṣaṇa, you can go with Aragyavardhini Vati, where the discharges are very foul smelling and patient needs some anulomana. Then you can go with the Aragyavardhini Vati. Next, Manjishtadi Kashaya. Manjishtadi Kashayam Katurakta Vikaragna Kapha-Pitta Hara. Okay, it is also Kapha-Pitta Hara, but usually we will not give in the early condition of the disease. Okay, for early condition of the disease, we will go always with the Patola Katuranyadi or Aragvadadi Kashaya, but not with the Manjishtadi. Manjishtadi Kashaya we will give in the later stage. Okay, because after the treatment, after some virechana, after the reduction of the some diseases or signs and symptoms, we need some raktashodhana dravya. Okay, Manjishta is also raktashodhana dravya, and there will be hyperpigmentations due to the infection or scar marks. There will be hyperpigmentation of the lesions. So to decrease and to remove the hyperpigmentation, we can go with the Manjishtadi Kashaya. Okay, maximum for classical medicines, within these medicines, in the acute case of Dadru Kuṣṭha of Kapha-Pitta dominant, these medicines, for my knowledge, okay, I am using this only. Since 6 years I am using this only. In this only we will get result. And coming to